Up next on Live It Up, we are joined by Dr. Liz and Melissa, and they are with Docs for Tots. Hello, my friends. How are you?
Good, Donna. How are you today?
Good. You're making the lives of children more enriched. What is Docs for Tots, and how did it start?
So Docs for Tots is a nonprofit organization working here on Long Island to promote policy, practices, and investments in young children prenatally to age 5.
Melissa, what is your title there?
Director of Programs.
Okay, and why did you decide to join Docs for Tots?
Well, my background was in mental health, and I actually worked a lot with young children in particular, especially children that were homeless. And I just found that there were so many issues that families were facing that they had to go to different places for, and no one was kind of looking at the big picture. And when I learned about Docs for Tots and the work that they do in really making those connections to support families to the fullest, I knew that it was the right fit.
And for you, Dr. Liz, you said that you were a pediatrician for many
Yes.
years in private practice. Tell us how you transitioned with this.
Sure. So for many years, I saw patients in a federally qualified community health center, which was an amazing place, and really tried to meet the complex health needs of children and their families. However, what I could do in the office with a stethoscope or an otoscope or these things wasn't enough. These families needed the professionals in their lives, the doctors, the child care professionals, many different community organizations, to work better together so that we could help them access the services and the supports they needed to support young children, their own children.
Why do you feel the children are at risk right now? Why is nobody paying attention to the health issues that they're having at an early age?
So one of the things that we see happening is everybody wants to save healthcare costs.
Okay.
But they want to save healthcare costs in the next 6 months or year or 2 years. By investing in very young children, we know that we can save money across the lifespan. There's a number of well-researched studies that show for every dollar invested in young children under the age of 5, that you can get return on investments of $7, $8, sometimes even $15 per year. That's better than the stock market. But you can't get those returns on investments in 6 months. It has to be a long-term investment. And that's what we really need to do, is work with our families here in Long Island with the existing supports and organizations, and make sure we're translating what we know works into what we do.
And what are some of the programs that you're offering from Docs for Tots?
Well, one of the best examples of programs that we've had is our developmental screening initiative.
Okay.
So we know that about 15 to 20% of young children have developmental delays. It's really common, and yet only about 30 to 40% of those delays are caught before a child goes to school. And that means that they could be behind for the rest of their school career. And it's actually very easy to ameliorate those issues if we catch them early. And the doctor's office is the best place to do that. Because we know that 92% of children will see a pediatrician or a doctor before they go to kindergarten. Developmental screening is the best way to do that, and yet not all doctors are screening when they should be.
Okay.
So one of the projects that we did was working with really high needs medical health centers to improve the way that they were catching delays by implementing developmental screening. And by doing so, we would kind of work with them to get them to do it on their own. So the whole idea is that they wouldn't need us anymore. It's just part of their practice. And after that project, we worked with 5 health centers and 1 hospital pediatric clinic in Nassau County. Over 1,000 screens have been completed since then. Over 100 referrals were made based on that. And that means over 100 children, and now counting into the future, are going to get services that they need.
That's fantastic. Because when a baby's born, a baby gets an apple scar, right? They're graded on,
Right.
their color and all this other type of stuff, their muscle tone and things like that. When you're talking about screening for things, what are the specific things you're screening for? Is it hearing, seeing, those types of things, or is it muscle tone? What are you looking at?
So really the developmental screen is about a child's general development. So we're looking for their physical, their language, their social, their emotional development. And the first recommended screen is actually as early as 9 months.
Okay.
And then we'll rescreen up until the time the child's about 30 months.
Wonderful. And you're able to detect things early, you're able to get them help. And that's
Yeah.
really what Docs for Tots is about
Yeah.
helping that early start.
And a screen is just a screen.
Right.
So it's not an end result. There's so many services out there where once a child may screen positive or borderline, they can go to other services that exist and have a full in-depth evaluation and see if something else needs to happen. But the idea is that we're looking at all children, not just a few of them.
And also having those conversations
Yeah.
with families in a way that maybe wasn't happening as robust previously.
So screening's also, I think Melissa hit on a very good point, is that screening is not only an opportunity to find things that may be going wrong, but it's an opportunity to celebrate what's going right. Because we know that children develop, given the relationships and the promotion that's happening within a home. If you think about, picture your first child taking their steps, right? Child doesn't take their steps on their own. They're taking their steps into your arm as you're waiting. And so that kind of promotion across all kinds of development, language, physical, emotional, and social. A child needs that kind of nurturing environment. And the more that we can point out to parents that they're doing well, they're doing a good job, parents need to hear that a lot more than they do. And screening actually gives us a great opportunity to celebrate achieving milestones.
Lovely. And as a non-for-profit, how can the community help you thrive? What is it how could they participate? What do you need?
Sure. So they're interested in learning more about Docs for Tots. They can go to our website, docsfortots.org. In addition, one of our major projects, Melissa can speak to it more, that we're going to be launching here in Long Island in 2018 is called Help Me Grow. I'm wondering if you might speak for a few minutes about Help Me Grow.
Sure, and that really stemmed out of our developmental screening work. We found that more screens were happening, more referrals were being made, which was great, but when we actually tracked what happened to those referrals, oftentimes the wheels fell off the wagon. It's not very easy when a family has a lot going on to follow through on things to make sure that they get the services that they need. And so we started looking to other states and communities that have had similar problems, and we found Help Me Grow, which is an evidence-based model of supporting families across systems, and it's been replicated in 51 different places across the United States. We're really excited to be working with a coalition of about 40 different partners in the medical community, early child care community, and public policy in order to bring this system to life to better support families.
I love that. And the Help Me Grow, my youngest child is now at my height. He's turning 12 on the 12th. And, the funny thing is he's charting, he's comparing how he grew compared to his older siblings, that are 27 and 24, and he's measuring it all the way. And it really is a joy to be able to celebrate those milestones, whatever they are in someone. So thank you very much for joining us, hoping to make a difference, helping you with Docs for Tots. So thank you so much. Stay tuned for more on Live It Up. Check out their website.